Bob, thank you so much for joining us. I really appreciate you
Oh, you're welcome.
taking time
I
like
appreciate
this,
it.
and
My pleasure.
just you sharing your story with us, and having the listeners sort of involved in that is so important. So maybe just to start off, if you can introduce yourself and who you are and what you did previously, what you're doing now, that'd be fantastic.
Okay. My name's Dr. Bob Richardson. I'm a retired kidney specialist or nephrologist. I worked at Toronto General Hospital for about 37 years, and one of my jobs there was to evaluate living kidney donors. I think that I probably evaluated between 700 and 1,000 kidney donors over 35 years. And so I learned a lot about living donation from both teaching about it to my patients as well as getting their feedback when they came back after donating. I retired 2 years ago. I'm enjoying life with my grandkids, playing golf, tennis, working out, bird watching, and all that kind of stuff. I donated 4 years ago when I was 68 years of age.
Fantastic. That's amazing. Bob, I think I can see your finger in the view. So yes, there we go.
I got it over the way now.
Thank you very much. That's great. Bob, can you just take us through your thinking? I mean, you were working in living donation as the medical director of the living donation program. As you said, you're very, very involved, not just locally, but nationally and internationally in living kidney donation. So you're quite a leader as well. When did you come up with this idea that you yourself would donate a kidney? Was this something that was stewing for a long time? Was this an inspiration that occurred?
Yeah, it was a slow process, Joe. I mean, I had a history of being a blood donor. I donated more than 100 units of whole blood, and then I became a platelet donor. So I was kind of used to, doing things, giving things to society as a whole anonymously. When I first learned about the idea of anonymous living donors, I was a little skeptical. I wondered if the people who wanted to donate to a complete stranger were maybe a little bit weird. But when I started seeing these people, they were just incredibly generous, warm-hearted, altruistic people. I was just totally impressed with them. And I guess in some way I thought, I should really try to emulate them. The person that probably made the biggest difference was my wife, because when she retired about 7 years ago, she actually came forward as an anonymous living donor and was all set to go through the process, but she was excluded for medical reasons that were found during the workup. But she really motivated me. And then just before I donated, I went to working half-time. So there was more time in my life to take the time off necessary to have the surgery and recover. And so it was sort of a slow process over many years. But those were the factors that I think affected my decision. And I chose that time because I wanted to do it when I was relatively younger. Obviously, I'm not a young person anymore, but I wanted to do it when I was relatively younger. I figured it would be safer for me, it'd be an easier recovery. And that's what led me to being a living donor.
That's really interesting. And how's your experience through the process? I mean, you were involved in having people go through the process and helping navigate that. As a patient going through that process, how did you experience it?
Well, I found it very educational because I was treated like any other donor. I cleared my donation with the coordinator and with the head of the kidney transplant program just to make sure that they would be comfortable having me as a patient going through the system. And people, even though I knew everybody that was involved in the process of evaluation, but they treated me very professionally. They treated me the same way as they would of any other potential donor. I found the workup very straightforward, very easy. Everything was well explained. Fortunately, there were no surprises along the way, so I was deemed suitable. And then the last step was to see, because my surgery was at another hospital, I saw a nephrologist at the other hospital and had another evaluation. So again, there was a very well organized, orderly process. It wasn't rushed. And I was certainly given lots of opportunity to say, you know, if I didn't really want to do this, I could back out. But I never had any concerns about that.
Great. And how did you find the surgery and the recovery period? Did it go well? Were there any sort of hiccups along the way?
Well, I think it went very well. I was in hospital for 3 days, 72 hours. I certainly had significant pain in the first 48 hours, but with the typical analgesia they give you nowadays, you're allowed to, press a button when you feel like you need some pain relief, and I found that extremely effective. So yes, there was pain, but it was very well tolerated with the pain medication. The day after I got home, I went for about a 1 hour walk with my wife with no difficulty. And I didn't take any pain medication, I think, after the first 4 days after the operation. I worked out at the gym after 4 weeks without any limitation. And I figured by 5 to 6 weeks, I was totally back to my previous state of health with no pain, no discomfort, no limitations whatsoever. So apart from the first few days when there was a significant amount of just incisional pain, I thought it was very, very smooth.
And if I remember correctly, Bob, you donated to the kidney pair donation system, is that right?
I'm sorry?
Did you donated to the kidney pair donation through kidney pair donation? Your kidney
yes, I would. Yes,
yeah.
Yes. Yeah, I was part of, I don't know I was not given any of the details, but I gather I was the initiator of a chain, but I don't know the details. And I never really wanted to know the outcomes. I just figured I'm doing this, whatever happens is going to happen, and it wouldn't affect the way I viewed my participation. If my organ didn't work, well, it wasn't my fault. I did what I had to do, and I just pretty much left it behind me after I got through the procedure.
And what would you say? How did it influence you, or how did it change the way, or maybe it didn't, the way you think about doctoring, being a physician, or the work that you had sort of, because you were still working at the time, I think, right?
I don't really think it changed anything. I guess just because there aren't that many nephrologists around, the odds of a nephrologist being a donor are kind of small. It's certainly not something that, ought to be considered something that doctors should do. It's obviously very, very individual. It just worked out for me that the circumstances, the time, and my knowledge of the whole process just allowed it to happen. So I guess in that way, I'm kind of unique, I think.
How do you think it impacted your family and the people, your main supports?
Yeah, my wife was obviously very supportive because she had planned to be a donor. I have 2 sons, both very, very supportive. I actually didn't encounter anybody who questioned my decision. So everybody was on side, which was very, very nice. They made it much easier.
That's great. Would you say that if you say, for example, if there's a physician colleague who's, as you said, it's a very individual choice, but if there is a physician colleague who's thinking about something like this, is there any advice that you can give, given your perspective, both as a patient and a physician who's very, very not expert in this area?
Yeah. Well, I think the most important to emphasize to any potential donor, physician or not, is that historically, this is a very, very safe procedure. The risks of major complications are extremely low. The long-term risks for donors are extremely low. The evaluation process is very thorough. Patients or potential donors are very well selected to reduce risks, both physical and psychological. And there are very few reasons why a healthy person who follows a good lifestyle should not donate. Obviously, there's a time commitment, both for the evaluation and especially in the post-operative period, and that may be a barrier for many people working full time, but it's not insurmountable. And I think the personal reward, which is obviously internally generated, is huge. I mean, you've done something really incredible for someone that is on or just about on the point of needing dialysis. And that has a huge impact on not just the patient, but their family. And I know that from talking to hundreds of donors after they donate, that they are very, very proud of themselves. They've had a huge impact on their families, and it's almost always a very, very positive event for the donor, the recipient, and everybody surrounding them. So it's something that everybody should really consider, not just doctors.
And if you sort of looking at this in hindsight, is there anything through the process that maybe you would have done differently or thought about differently or reflected differently?
No, I don't think so. I was really impressed with the evaluation not being just a medical, physical evaluation, but both the coordinator and the social worker really went into depth on the social, personal, family background, just to look for any evidence that there might be some kind of psychological harm or perhaps a motivation that wasn't appropriate. So it's a very in-depth evaluation, but it's very open, fair, and I think both from a patient point of view, my own experience, and from what I've seen as a member of the team that evaluates donors, I really think that we do an excellent job of making sure that the decision to donate is the right one for any individual patient to reduce any possible physical, medical, or psychological risks in the long term.
Mm-hmm. And I think you mentioned this earlier, Bob, but the importance of appropriate follow-up there afterwards. I assume that you're sort of maintaining follow-up with your family physician, as we sort of usually advise. Is that ongoing? Yeah.
Yeah, we basically recommend seeing the family physician once a year. The most important things after donating are to monitor blood pressure, because all of us have a tendency to get high blood pressure as we get older. And with a single kidney, the development of high blood pressure would increase the risk of kidney damage a little bit more than if you had two kidneys. So blood pressure monitoring is considered really important. And then doing some blood tests every year just to make sure kidney function is stable is also recommended. The fact is, though, that the risks to donor long-term are very low. I think we make these recommendations for follow-up because we just want to make absolutely sure that donors don't run into any trouble in the long run that could be prevented.
Mm. And you'd mentioned that, or we just mentioned earlier that your kidney went into the kidney pair donation system that actually prompted a chain. So in many ways, actually, you mentioned earlier that you impacted positively in someone's life, but it may have led to multiple transplants, and which is phenomenal. Yeah. And
whenever I talk to people sometimes that I meet socially or on the golf course about the whole pair donation process, and they're absolutely amazed. I think it's a fantastic piece of social engineering to maximize the benefit for people across the country. It's a system where an anonymous donor can come in and provide an organ that can trigger a long chain, 2, 3, 4 or more kidneys that otherwise wouldn't be able to be shared. So it's a particularly valuable part of the living donation program in Canada and elsewhere. And the system works extremely well.
And as you sort of course experience, the anonymous donor is a very important part of that, those creating those chains in
Yes.
in that system. Yeah. So it's, I mean,
Yes.
when we originally sort of, as you said, Bob, when we originally heard that people just wanted to give their kidneys, it took us a bit aback, but now it's becoming pretty much, it's quite commonplace now.
Yeah.
Yeah.
I think in this field, change comes slowly.
Yeah.
I can remember back in the mid 1980s, the idea of a spouse donating to their loved one seemed radical. And then after a while, it became routine. And then we talked about friends giving kidneys to their friends, and that seemed kind of pushing the envelope. But then it became routine, and then the idea of anonymous donors came. People giving a kidney to somebody that they didn't know and probably never would know. But I think changing slowly is the best approach, because in this field, you don't want to go pell-mell into a new situation without careful consideration of the risks and benefits. And it's especially important that you avoid mistakes or bad outcomes that could be avoided, because they could have a very deleterious effect on a program's reputation. So I think being cautious is, well, that's what doctors are all about, I think, is being cautious. But being cautious, I think, is the very best approach in this kind of a field, which has so many social implications for families and society as a whole.
And we as the medical team are effectively putting someone who doesn't need a procedure or surgery into harm's way. And so you're absolutely right.
Exactly. Yes.
Yeah, absolutely. Yeah. So
I've always, sorry, go ahead.
Oh, no, please go ahead, please.
You know, when that subject was raised of putting somebody at risk, my counter argument is, well, then we should never have people going into the armed forces or into the police or into firemen, because we put them at risk. But risk is part of a lot of things we do, and as long as the risks are manageable and can be described, then it's a perfectly reasonable thing. But you know, lots of human beings go into occupations that put them at very, very high risk, much higher risk than a kidney donor would anticipate or undergo.
That's a very good point, actually. And with the understanding that out of that effort and risk, something good comes out of it, and basically living kidney
Absolutely.
donations.
Absolutely. Yes.
Absolutely. So Bob, what's next for you? I mean, it seems like things are going really well in retirement. What's on the horizon for Bob Richardson?
Well, there's nothing specific. My wife and I celebrated our 50th wedding anniversary about 2 weeks ago.
Fantastic.
We were going to have a good party. Going to have a big party, except it got canceled because of coronavirus. So, you know, I play tennis a couple of times a week. I play golf a couple of times a week. I bird watch. I work out. I spend a lot of time with the grandkids. Not doing very much traveling, but life is very rich and satisfying right now. There's no specific plans, and certainly no travel plans because of the coronavirus.
Fantastic. And Bob, just to maybe then to close off, is there anything that you'd like to share with the listeners that you think that we may not have covered, or anything that any parting words that you might have?
Being a kidney donor is an extremely satisfying accomplishment, if you like. I mean, I feel proud of myself, and you know, I don't share the fact that I've been with a donor with very many people, but it certainly has made me feel very proud of myself, and very satisfying in terms of the experience.
Fantastic. And I'll share with you, Bob, it's been a source of great inspiration for your colleagues as well, and certainly personally as well. Yeah, absolutely.
Thank you.
It's incredible. Thanks so much, Bob. This has been an absolute delight. It's been absolutely a pleasure. So great to see you again.